Hello, my name is Dr. Nitin. I am from Pune, India and working as a family physician. Next few minutes I will try to elaborate a major complication of diabetes, that is peripheral arterial disease or PAD. Diabetes means having persistent high blood sugar levels due to various reasons. According to World Health Organization, around 177 million people are having diabetes and the number will increase up to 366 million by 2030. There will be huge burden on the healthcare system to manage diabetes and its complication. From all this diabetic population, around 20 to 25% people are having detectable peripheral arterial disease. Now, let us understand what is peripheral arterial disease or PAD. It is a macrovascular complication of diabetes. It means a complication related with large blood vessels of legs, and unlike of those small blood vessels such as in eyes and kidneys. Have a look at this picture, which is showing a normal blood vessel on your left side with a normal blood flow, and on the right side narrowed or blocked blood vessel by fatty deposits and eventually reduced blood supply to the muscles of leg. As we say heart attack or brain attack or stroke when a blood supply gets reduced to the heart and brain. Similarly, PAD is a leg attack and happens due to less blood supply to the muscles of leg. Most importantly, if you have PAD, then down the line 5 years, you have around 20% increased risk of getting heart attack or stroke, and secondly, it is also associated with increased risk of lower extremity amputations. Long duration of diabetes and age puts you at risk for PAD. In diabetic population over the age of 50, the risk of getting PAD is as high as 29%. The UTPDS trial, which is a very important trial in the field of diabetes, showed each 1% of glycosylated hemoglobin, that is your average blood sugar over the past 2 to 3 months, are correlated with 28% increase in the incidence of peripheral arterial disease. Further, is risk even greater when associated with some other risk factors like smoking, high blood pressure, increased blood cholesterol levels, if your weight is high, that is if you are overweight or obese, if you are not engaged in regular physical activity such as walking or other exercises, and your personal history of heart attack and stroke. Let's see stage-wise warning signs and symptoms of the peripheral artery disease. Look at this self-explanatory image which shows stage 1. While examining, your doctor will feel weak or absent leg and foot pulses. Stage 2 is intermittent claudication, and in this stage person feels pain in his calf region while few minutes of walking or climbing staircases, and generally the pain disappears with a few minutes of rest. If PAD progresses in stage 3, pain may even occur when you are at rest or lying down, called ischemic rest pain. It may be intense enough to disturb your sleep. In stage 4, one may get slow healing or non-healing injuries or ulcers on feet and leg. Other features like leg numbness or weakness, affected leg becomes colder than normal leg, hair loss or slower hair growth on affected leg. It is important to know symptoms to get timely treatment and prevent further complications, as many of those with warning signs don't realize that they have PAD and many land into further complications. Now, how to diagnose PAD? The ankle brachial index is one test used to diagnose PAD. Have a look at this picture showing the way the arterial index is getting measured. It is a ratio of blood pressure in the leg to the blood pressure in the arm. If the blood pressure in the lower part of your leg is lower than the pressure in your arm, you may have PAD. For screening purpose, the American Diabetes Association recommends this test for people with diabetes over the age of 50. Some other tests like ultrasound, MRI or CT scan and angiogram are also being used, and your doctor will recommend you as per your need. Now the treatment part. American Diabetes Association recommends few steps to treat PAD and prevent further complications, such as a good control of diabetes, blood pressure and cholesterol levels. Keep yourself engaged in regular physical activities such as walking. Drop that cigarette and quit the smoking. Your doctor will prescribe medications to help relieve symptoms and further complications of PAD. In some cases, surgical procedures are required like angioplasty or bypass. Now, throw some light on the part of prevention. Get yourself aware of your family history related to PAD, heart attacks and strokes, and be sure to convey to your doctor. You can't change age or your family history, but taking care of your diabetes and other risk factors such as smoking can lower your chances of having PAD. Lifestyle modifications such as weight loss, physical activity and healthy diet all help reduce the risk of developing PAD. These changes also can help prevent and minimize risk of getting few conditions like heart attacks, blood pressure, high cholesterol levels and strokes, which are again associated with PAD. PAD causes significant long-term disability in people with diabetes. So prevention, identification and treatment to reduce further complications give a near normal healthy life. Take care of your health. Thank you and goodbye.